My name is Lisa Murphy. I am doing a part-time Masters by Research in nursing and my topic is patient experience of nursing values in the context of the model of care that's in use. I currently work in nurse practice development in Vincent's Hospital. I've been there for 5 years. A lot of the work is project-based. I would touch on all the different medical and surgical and specialist areas of the hospital.
My name is Thompson. I'm a part-time PhD student here in UCD. My study is looking at the role of ANPs within the service. In my background, I'm a nurse. I've been in the emergency nursing area for the last 20 or so years. I've worked in different roles within the emergency departments, right from staff nurse to clinical nurse manager, and I'm currently the nurse practitioner. Also, I'm involved in education. I'm an associate lecturer in IT Carlow.
I think the Masters by Research has kind of opened up a lot of opportunities and opened my mind up to kind of what's important for nursing. So it's not just about the practice on the ward, obviously the evidence base behind it and actually nurses doing the research rather than it being done by other professions.
There's so many balls up in the air in regards to juggling when you're a part-time student. Time management, travelling, and they all kind of are considered as well as laying down a full-time job and having a life outside. So, but I don't mean that's everybody, and I knew that starting the PhD.
Because it's a Masters by Research, it's not a taught Masters, so I've tried to kind of tap into as much of the kind of services that are available in UCD. We recently had an in vivo 2-day seminar that I was able to attend. A nice opportunity to meet other people that are on their Masters or PhD and to be able to kind of bring it back down, so even if they're talking about stuff related to the PhD, that you can actually relate it to your Masters. My supervisor has been fantastic and the support from everyone in UCD has been amazing. It's a lot harder than I expected it to be. And the fact that it's a Masters by Research, that kind of self-direction has been an interesting journey for me and has kind of opened up my mind to kind of being able to make a different path or not having to do stuff in a certain direction.
I did my postgraduate here in UCD and I knew a few people who worked within the university itself, so I was able to connect with them to find out what opportunities were there in regards to doing a PhD part-time. The Nursing, Midwifery and Professional Development Unit are offering an element of funding towards the PhD, and also the school itself was very much so aligned to what I wanted to focus on. It was very nursing driven. Their research goals were very much so tied in with what I wanted to study.
You really do have to have an interest in it and a passion in it. There's a huge amount of support within UCD and it's very achievable.